Welcome to Covered, a health insurance podcast by the Montana and Mountain Health Co-op. Purchasing health insurance can be complicated, expensive, and downright intimidating. We're the world's first podcast designed specifically for you, the individual, family, or business looking to make the important decision on quality health insurance, told through the stories of our members and insurance experts. If you're looking for answers about insurance opportunities in Montana and Idaho and seek some inspiration along the way, we've got you covered.
And just like that, we're live with Jarett Laden. Jarett, welcome to the podcast.
Thanks.
Excited to have you here.
Glad to be here.
Yeah. So for our listeners, if you wouldn't mind just briefly introducing yourself and what your role, or I guess what your relationship is with the co-op.
Okay. So my name's Jarett Laden. I'm an independent health insurance agent here. I help individuals and families in Montana and Idaho, as well as small businesses in both states, obtain health insurance. My relationship with the Mountain Health Co-op, I'm a past employee, worked here for about 5 years, and just recently branched off into my own independent status, representing not only Mountain Health Co-op, but also Blue Cross Blue Shield and Pacific Source. Mountain Health Co-op is definitely a company that I look to first.
Very cool.
So,
as somebody out there listening who says, hey, I'm underinsured right now, or maybe I don't have insurance, or I'm just thinking about switching things up, why might somebody reach out to you, and what value can you add to their lives or add to their search for health insurance?
A lot of people, have questions on the tax credit, when it comes to their income, whether they overestimate, underestimate, what actual number to use. Is it gross income? Is it net income? What income is it? Folks that may be commissioned or self-employed and have those peak and valleys in their income.
Right.
And you can really get in the trenches with them and say, if this is the income we're going to use, if you're underestimating, there's a chance you may have to pay some of that tax subsidy back. And vice versa, if you overestimate and your income comes in lower than we estimated, then there's a chance you may get a little bit of tax credit back too. So that's a big thing there is when it comes to tax reconciliation, making sure that your client's not going to be penalized hard at tax time and making them aware of that.
We haven't talked too much about the tax credit.
Okay.
Can you help educate our listeners as to what that is and why people might start the conversation that way? Like, I heard about this tax credit, or what is that all about? So
when the Affordable Care Act came out in 2014, basically did a couple of things. First thing it did is made health insurance available to all consumers with no pre-existing conditions. So kind of a guaranteed issue, and the rates are just determined on the age of each person. So unfortunately, the older you are, the more you'll probably pay for health insurance because there's no more pre-existing conditions.
Sure.
But with that, they also came out with a tax subsidy that consumers can apply for. And basically that tax subsidy applies to families or individuals that fall within 100% and 400% of federal poverty level. So, for a family of two in 2020, you're looking at an adjusted gross income of about $67,500 is about the maximum that they can make and still qualify for a tax subsidy.
Okay.
So and every income or a household size is going to have a different income, but for a family of two, that's kind of what you're looking for. So, so let's say we put $67,000 on their tax application, and that gives them a tax credit of $1,000 a month that they can use as a quote unquote allowance for health insurance. When they reconcile their taxes in 2021 for 2020, if they show $70,000 on their tax return, then they may have to pay some of that tax subsidy back because that $70,000 would make them ineligible for that tax credit. So it's really important when you're talking to them to say, okay, you need to, I recommend people talk to their accountant a lot and get their advice because it's an estimate for right now people are estimating their 2020 income, because
Right.
that's the plan they're applying for. So it's hard for people to do.
Yeah, sometimes if they're, like you
Yeah.
said, if their income peaks and valleys,
Yeah.
if they're,
So
yep, on
I always
commission.
recommend, if we can overestimate a little bit, it's going to be better, because there's a chance that you'll get some back when you reconcile your
Yeah.
taxes. So I always like my clients to get something back
Got it.
instead of having to pay something back. So
If someone doesn't have an accountant, H&R Block, can you walk in there and they can help you out, or what would you recommend?
yeah, I mean, if somebody doesn't have an accountant and they've been doing their taxes on their own,
Yeah. They've been
I
running through TurboTax.
yeah, I honestly look at the last 2 or 3 years, and I say, okay, what, especially if they're self-employed, I say, what's your business model looking like in 2020? Are you looking at about the same for the number of clients? Are you looking about the same for income?
Mm-hmm.
Is there anything going to change? And then you kind of can look at the last 2 or 3 years and kind of estimate, and then maybe add a little bit in to just to make sure cover any fluctuations.
Be I guess conservative in your estimates.
Yeah.
Or is that
But honestly, it's up to the consumer. You let them know about these options, but the income they use is ultimately their decision.
Yeah.
They know their income better than I do.
Right. Right.
So
So Jarett, somebody comes to you and says, here's my situation. I'm thinking that Mountain Health Co-op might be a good option. I've also heard about Blue Cross Blue Shield and Pacific Source. So how do you help people navigate that decision? Because there are a lot of options out there.
Right. You got to talk about doctors. You got to talk about networks. Find out if they do have any medical conditions, any prescription drugs. What kind of drug plan do they want? Do they want one that's going to be subject to their deductible? One that's going to have a flat dollar copay? So just kind of find out what their medical needs are, so you can kind of nail down, first of all, what kind of plan they're going to need, whether it's a high deductible plan, mid-level, maybe a high deductible plan with a health savings account, to get some pre-tax dollars saved in a health savings account. And then you kind of dig into, I guess, risk versus reward, I mean, because the benefits on the plans differ so much between insurance companies, and the premiums do as well.
Yeah.
So you really just got to find out what their medical needs are. They do a lot of office visits, prescription drugs. Have they met their deductible or out-of-pocket expense in the past?
Yeah.
If so, do they have a condition where they're expecting to meet that again this year? And then if they are, then it's a really simple calculation.
Yeah. I'm sorry.
Really simple calculation. You add up the monthly premium, total out-of-pocket expense for the plan, and I usually recommend.
So you help them walk through all that, and just that's nice,
because that's your maximum liability. If you know that, hey, I'm going to have $100,000 in medical expenses, that's going to hit my out-of-pocket expense. Most plans have an out-of-pocket expense of $8,150.
Okay.
Add that in. Add your monthly premium for the 12 months.
That's
Whichever one's lowest is probably going to be your best. It's going to cost you the least.
Yeah.
You know.
What have you found to be like the ideal co-op member? So, you know, if somebody says, here's my situation, you say, well, this might not be great for you. But somebody says, here's my situation, you say the co-op is absolutely the choice for you.
For 2020, you know, the co-op really came out with all of their plans. They have a bronze plan, silver plan, and gold plan that are kind of tailored to the community health centers.
Mm-hmm.
So here in Helena, that would be the Peerview Health Center.
Right.
And it offers co-pays as low as $5 for an office visit.
Wow.
So they're really, really nailing down on the primary care. Getting in, seeing your doctor, cost you $5.
Avoiding the ER visit if you don't have to.
Yeah, you know, get in, see the doctor, pay $5, you know, $10 on the bronze plan.
Yeah.
And really a office visit copay on bronze plans are really unheard of. And actually a $10 copay, we haven't seen that in years.
Really?
So
this is new.
Yeah, so they're really geared towards the community health centers.
Okay.
Which offer great primary care.
Yeah.
And then
for a lot of people, that's right in their wheelhouse. Exactly. Just what they need.
Yeah, and a lot of these folks already use those centers for services.
Sure.
So it's just an added benefit with that low copay.
Yeah. So you spent some time here. at the co-op. And for those watching the YouTube, we say this a lot, but we're recording in the co-op's offices here. It's a super friendly environment. What did you take from your employment here when you left to launch your own business? What things did you take from the co-op and say, I take that with me today. I learned that working here at the co-op, and I use that to this day.
Essentially the whole history of the co-op. I was able to take with me because I was here when they first started operations in 2014.
Cool.
And we were not short-staffed, but as a new health insurance company, you kind of wore a lot of different hats. So I was able to learn a lot about different departments: finance department, claims department, providers, sales, benefits. So I learned a lot about just healthcare administration in general, because I had to. You're a new health insurance company. Yeah. It's your job. You got to do it. You got to make sure that you're following, compliance and things like that. So I learned a lot about compliance, DOI regulations, and I take that with me now, and I'm able to kind of tell the story of the co-op to consumers and small businesses, and really explain where they've come from and what they've done and where they're going, and how much they've improved the customer experience. I mean, it's been leaps and bounds,
really,
in what they've done. So
yeah, it seems to me like the ability to call a co-op, talk to a real person, and the stories after stories of people who have unique circumstances where it doesn't fit into, it's a square peg trying to get into a round health insurance hole, and how the co-op just helps sand that peg right down and get it figured out, and work with different networks and work with different states and providers to just help members, which is something that really resonates time and time again in these conversations.
Yeah, I mean, some of the things that they've done over the years are just, they've got telemedicine benefits now. So like a tele-doc, you can call a doctor if you just got a ear infection or something, explain the symptoms to them, and more than likely they'll be able just to call you in a prescription, so you don't have to go see a doctor.
Wow.
They've got a vision benefit on their plan now, a $60 reimbursement vision benefit. That's a big thing, for some of these folks. It's going to cover most of an exam for you,
for sure.
So, and then what they've done with their providers, the amount of providers they actually have for Montanans to access, that they've done in a short amount of time. I mean, you're talking 7 years that they've been working on getting their provider network set up.
Yeah. And
I don't know the numbers now, but I know that they've got a lot of providers in Montana that Montanans have access to as in network.
That's powerful. It matters.
Yeah. Know. And they used to, there used to be a segregation between hospitals in Missoula and Billings because you got competing hospitals there. Well, the co-op was able to actually take that away, and now they've got both hospitals in network on one plan. So that's huge.
Right. Things that didn't exist before that now seem like, oh, of course.
Right.
Of course it does.
Right. So
yeah, great. A piece of advice. This is a question that we like to ask each guest, is what for people out there that are looking for insurance, undecided about which provider to choose, what piece of advice might you have for them in the research phase? We're in open enrollment right now, November 2019. What's a piece of advice that you might have for somebody in their shoes?
I would honestly recommend calling each insurance company, seeing what your wait times are,
what the experience is like,
what kind of customer service experience you get from the folks on the phone, because that's going to kind of show you what's going to happen after you become a member. I mean, if they should be treating you the same whether you're a member or not. So if you get good service when you're just a prospective member, you're going to get that same service, when you're looking for customer service. And also, don't just look at the rates. I mean, rates are pretty competitive in the state, but look at the company itself and where they've been, what they've done, and kind of what they stand for. You know, and I think you'll see a big difference between the three carriers in Montana as far as that's concerned.
Cool.
Mission statements and things like that. So
that's great advice. I think doing some due diligence, figuring out what feels right, and you'll know that pretty soon. I think pretty quickly. We didn't get a ton of time to learn more about you and your world, but hobbies. What do you like to do? And we sometimes ask, what's the hobby that puts you at the most risk for using your health insurance?
I love being in the outdoors, hunting and fishing, and unfortunately, I don't get much time with my kids being younger right now. But when I get time, I do enjoy just the peaceful sounds of nature.
Yeah.
The creek running through, and whether I get something hunting or catch something fishing, that doesn't matter to me.
That's not the top priority.
Right. Yeah. And but honestly, there's a risk there of something happening and using the health insurance that I do have.
It is Montana. There's a lot of wilderness, with that comes some risk.
Make sure you're covered for ambulance care and things like that. So
yes,
which all the plans are with
knock on wood.
You
don't have to ever use it, but
and there. Then as my kids get older, it'll be something that I can share as a pastime with them.
That's great. Is there anything that I didn't ask you that you were hoping I would ask you, that you were like, oh, I wish Kyle would have asked me this, I want to share this today? Or do you feel like we covered quite a bit?
I think we've covered most. If you if you want to contact me, I can always be reached through Montana Health Co-op. They all have my contact information.
Great.
I don't do much social media, but I am available for appointments for individuals, families, and small businesses.
Perfect.
And like I said, my contact information is at the co-op, and
and we can put those in the show notes also.
Okay.
For you. So
cool.
If anybody's watching or listening, they can click into the show notes and find out how to contact Jarett and get in touch and ask him more questions, because it's confusing, and having experts out there like yourself that can help is a huge win for co-op members and everybody out there. So appreciate the time.